And another thing that we hear is, what will happen if I decide to do this? What's most important for me right now? Another thing is around my family just doesn't understand. And also that concept, we hear this a lot as well. So that how do you maintain being positive and yet have those difficult discussions that you sometimes want to have with your family? And so does having the difficult decision mean that you're not being positive? And I don't think that that means that, but certainly there's a perception around that. So how do you do that? How will we know if my cancer is in remission? So, and that would be, and one of the decisions earlier that I didn't bring to the forefront is around the decision around should we monitor my CA-125, so while in remission, or do we just wait for me to have symptoms and then look at the CA-125? And so that big piece around how do we then know what's going on if we don't have a CA-125?
Right.
And I think you were talking about your friend who was wondering about chemotherapy earlier. So does starting chemotherapy sooner make a difference? And if you delay starting chemotherapy, then what's safe and how long can you delay? So I had some patients tell me, you know what, I didn't realize that I was going to tolerate this chemotherapy as well as I am compared to my first time I was on chemotherapy. And had I known that, I made decisions, to not move. This one patient in particular wanted to move back closer to her family, and she didn't do that because she was afraid she was going to be too ill with chemotherapy. And she says, had I known that I was going to do so well with my chemo, I would have moved and still done that so that I could be closer to home, and even if I was doing that halfway through my treatment. So if you move to the next slide, now that we've kind of have an idea of what we're talking about, these difficult decisions, does sharing in the decision make a difference? Well, we know from one study with women with breast cancer, and what they did is they followed women, quite a few women, 205 women with breast cancer for 3 years. And they asked them about making decisions. And so women definitely through that study said that they wanted and they preferred if they were more involved in making treatment decisions. So women would have, if they were happy with that, and if they weren't, they would have wanted to be more involved in the decisions. And women who were actively involved in choosing their surgical treatment options, so this was whether or not to have a mastectomy or a lumpectomy followed by treatment, so the surgical approach was different. So women who actively participated in that piece had a better quality of life and felt less fatigued. So if you change to the next slide, so what is shared decision-making, and what does that mean? Essentially, it's the role of two groups of people. So the providers, or the physician, and then the patients. And the role of the physician is really to diagnose the problem and to present options. And the patient's part in making the decision is really about really communicating well to the physicians what's important right now, what are the person's values, and what are their priorities, because that will help influence the physician in how they make recommendations for treatment. So, for example, in that, let's say a person has a diagnosis of a recurrence of cancer, and the person was considering taking a trip. So knowing that there is a plan in place around traveling will help the physicians make a recommendation as to, what happens with that trip. Is the trip booked right now? Do we delay starting chemotherapy to make sure that the trip happens? Do we look at changing how we coordinate chemotherapy so the person can travel during the chemotherapy? So we do a bit of chemo, then we make the trip. So some of those things. So what is happening in the person's personal life? And the last thing around shared decision making is, does every decision have to be shared? So does everybody, is that what we should be aiming for? And I guess the answer to that is no, because the role and how you make the decision should be based on your preference as a person. So for some people, it will be shared decision making. So the physician presenting recommendations and the patient saying what's important, and then together kind of figuring out what's the best thing to do. Another way people make decisions is, for some patients, they want to make the decisions by themselves. So, doctor, tell me what my options are. I'm not going to tell you about what's important to me. I'll just decide between the 2 or 3 options you're giving me. So that would be kind of an independent way of making decisions. And another way of making decisions is more of a passive way. So where the doctor will basically make one recommendation and the patient will agree or not agree to that option. Or another way of making passive decisions, and we call them passive just for terminology reasons, is where the options are presented, but perhaps to somebody else, so a family member. And the family member totally decides. So in certain cultures, that's the way decisions are made. And when I talked about shared decision-making, it's not necessarily between the patient and the doctor. It can be between the patient, family, and the doctor. So there's different ways where that happens. Or it might be that it's an independent decision, so the doctor presents options, the family goes off and thinks about it and discusses it, and then comes back and says, this is what we've decided to do. So there's very, very different kind of ways a decision can be made. So if you switch to the next slide, so what's the problem? So why are we not really doing that? We know from, in 2009, I was at the Ovarian Cancer Forum, and through the discussions between healthcare providers and patients, one of the recommendations that came out of that in '99 was that we should be providing more education, and certainly women wanted to participate more in making decisions, but people didn't know how to do that, and so certainly more education should be provided around how to do that, and certainly we should be using more decision aids in practice. So, and I don't know whether or not we've made a lot of movement in doing that better since 1999. So what's happening from a patient's perspective is people are unsure what to do, and they're struggling with how to participate in making the decision. From a practitioner, so a nurse or a doctor's perspective, what's happening is they don't always realize that people are struggling with making decisions. And the other thing is, often what we do is we see that this person is having a hard time, but we give more and more information. So we focus our intervention on giving them more information about what they can do. And when there are decision aids, they're rarely implemented in practice. So they get developed from a research perspective, but implementing them, or they're implemented in the center that develops it, but not necessarily implemented and communicated out to other healthcare providers. So if you switch to the next slide, what do you think would be a good decision? What do you think, Aris?
I think a good decision is, for me at least, it's something you feel good, afterwards when you've taken the decision. Also that you think that at that moment, at that particular moment, it's the best decision you can make.
Yeah. Rudine, is there anything you want to add to that?
No, I would agree with that. It has to. You have to be comfortable with it. So it has to make you feel good, just as Iris said. So.
Okay. So if you switch to the next slide. So from a research perspective, they looked at and trying to define what a good decision is. So researchers, physicians, people who have expertise in decision-making have identified kind of 2 basic criteria for saying that was a good decision. So it has to be based on exactly what you've said. You have to feel good about it. So it has to reflect your values, what's important to you as an individual, and it has to be informed, right? Because if it feels good because you think, if I get... Oh, geez, I'm trying to think of something. If I always look on the right side of the street before walking, I'll never get hit by a bus. Well, you also have to think about the left side, right? So what you're basing your decision on has to be based on information that's accurate. So that's the informed piece. If you switch to the next slide. So we talked about what made a decision difficult before, and just in case we haven't covered all of those things, I'm just going to name a few other things that we know make decisions difficult. So the number of options available certainly make things harder. So if there's only one thing that you can do, so the choice is really you do A or you don't do A. That makes the decision sometimes easier. other times, the option might be do A, do B, do C, or do nothing. So the more options you have available, and that could be around treatment or it can be about something else.